Good morning. On behalf of the Lower Shore Regional Opioid and Addiction Coalition, I welcome you to this very important leadership conversation and symposium to discuss the opioid and addictions crisis affecting everyone in our country, everyone in our state, and everyone here on the Lower Eastern Shore. I'm Roger Fallabout. I am with Peninsula Regional Medical Center, and I am honored to be your MC for this important conversation to bring our four Lower Shore counties together, to encourage collaboration, and to bring awareness to some of the great things that we are already doing in this battle against the epidemic. Today's event is the brainchild of the Lower Shore Regional Opioid and Addiction Coalition, which was recently formed as an outgrowth of Salisbury Mayor Jake Day's START task force, which you'll hear more about shortly, to ensure that the conversations, the knowledge, and the best practice sharing goes beyond Salisbury and covers Worcester, Wycomico, Somerset, and Dorchester counties. Please know that today is planned to be just the beginning of increased regional communications and united efforts wherever that's possible. The Regional Coalition will want many of you in this room today to participate in these county and regional efforts, so begin thinking about what you can do to be a part of that and to contribute to the success of this regional effort as you're with us here today for the next 4 hours. I'd like to reiterate that our focus today is to share local and state perspectives and to highlight national and local successes to inspire hope and also that continued collaboration. And we are here to do just that in this wonderful, state-of-the-art academic commons building at Salisbury University, thanks to the continued and generous support of Salisbury University President Dr. Janet Dudley-Eschbach, who is with us now to bring her welcome from the university. Janet, good morning.
Good morning, everyone. We're always pleased to host special events at Salisbury University, and this is our newest facility here at the university, the Academic Commons, which really is the model for the library of the future, and we're very proud of it. And it's kind of bizarre to be in here when it's relatively quiet. Normally, the building, every floor, every level is abuzz with student activity. And just a few feet from this beautiful room, you'll see a tower where a traditional carillon is in the process of being installed. The first bells were hung just last week, and it's kind of special for us. There are only about 200, maybe not quite even 200 traditional carillons in the nation, and in the state of Maryland, ours, I'm told, is only the third. And I think the only carillon on any college or university campus. So I think the bells, again, which are in the process of being hung, really signify the quality of this outstanding university. We're very proud. But I also think about the bells, and I'll get back to this in just a moment. I think about the bells when I consider the purpose of this meeting and the serious crisis that our nation is facing and what has brought everyone together today. There's not one person in this room who has not had a family member or friends who have been in one way or another touched by the scourge of addiction, whether it's alcohol, drugs, or some other deadly craving. A colleague recently told me that in the past 18 months, he's known 4 area families who've lost children to drug overdoses. And these families ranged from a hardworking blue-collar family to multimillionaires. And they're of many different backgrounds, whether it's financial or ethnic, whatever the background might be. Some were highly educated, and some of those lost were engaged in rehabilitation programs. Just this last week, I got a phone call from a friend. I have deep ties to the state of Maryland and Delaware. My husband and I have a place in Fenwick Island. Just last week, I got a phone call that one of our neighbors lost his son, who was addicted to drugs and alcohol. He died. He was 50 years old. He had 2 children. And so this crisis touched me very recently myself. So I'm grateful to all of you, to all of our community leaders and state officials for coming together to look at new and creative and our ongoing ways to confront this horrible epidemic. I applaud Governor Hogan and his office for sponsoring this symposium. I have a profound respect for the expertise, talent, and passion of all of you who are gathered here today, and we're grateful for your commitments. At Salisbury University, as you can imagine, we too are part of this struggle. Like other universities throughout the country, our lives have been affected, and we struggle to understand and to help somehow to try to find a way for those who suffer. Like many of you here, the university confronts the problem on multiple fronts. Our Dean of Students, Valerie Randall Lee, has been engaged with the community in providing the necessary tools and support for our students, and the head of our SU Police Department, who I saw here. By the way, is Val here today? Val, thank you so much. Chief Lashley, Chief of the Salisbury University Police, has been working with fellow police officers to explore the enforcement element of this issue, and a number of Salisbury University staff members and faculty have been engaged in various areas, all in an attempt to understand, to try to deal with the problems, and yes, to heal. All of our students at the university are required to complete an educational program which covers drug abuse and bystander prevention. Our counseling center offers small group meetings as well as individualized sessions, and we continue to develop our local partnerships and have speakers come to campus to talk with different student organizations, including members of Greek Life. Our resident assistants are trained on what to look for in students experiencing a drug crisis or overdose, and on how to provide immediate medical assistance, and we also provide Narcan training to any member of the campus community who is interested. And I stop and think about this and how sharply that reality today compares with back when I was in college. Very different issues, and certainly heroin addiction was not did not have the size problem. It wasn't as prevalent as it is today. And I think at the same time it was a problem, but maybe it was underground. I think as more and more middle-class families have been impacted, it's gotten greater attention. And at the university, as I said, in terms of our counseling center, our educational efforts, our academic programs, which range from nursing to social work, have different types of courses and clinical experiences that examine the social, psychological, physical, and societal impacts of drug and alcohol addiction. Our Child and Adolescent Behavior Health Education Initiative provides resources to regional professionals working with families that are in one way or another affected by addictive behavior. And Salisbury University's Eastern Shore Regional GIS Cooperative is working with the Governor's Interagency Heroin and Opioid Coordinating Council, the Maryland Departments of Health and Mental Hygiene and Information Technology to create an online dashboard that will visually display the progress made on reducing the number of overdose and deaths from heroin, fentanyl, and other opioids. I believe there are lessons to be learned from this addiction crisis if we're willing to listen. Late SU sociology professor Dr. Phil Bosserman, who's memorialized with our Bosserman Center for Conflict Resolution, once sponsored a conference here on campus on alcoholism. And when a reporter asked him, "How do we combat alcoholism?" Dr. Bosserman offered a short reply: improve reality. Were it that easy? For those who suffer from heroin and other opioid addiction, and for those family and friends who love them, how do we improve reality? What does that mean for the addict? This is why it's so important that state and community leaders, as well as experts in the health and mental hygiene professions, are here. Today, together, we are doing what we can to combat the crisis. A couple of thoughts in closing. A couple of years ago, there was an alum who came to see me, and it was right before the start of the fall semester, and he told me that his daughter hadn't applied on time, missed the deadline, but wanted to enter our graduate program in history. And I sat with this graduate and his daughter. The graduate, by the way, very successful alumnus and big donor to the university. So I sat with the two of them, and it was kind of a no-brainer. This young woman, who was so impressive in every single way, wanted late admission and an exception, basically, to get into our history program. And I said, of course. We spoke with the head of the history program. Her credentials were stellar. No problem. She got in. So a couple of weeks later, by the way, this alum lives in Omaha, Nebraska. And in a way of saying thank you, he sent me a big pack of Omaha steaks. I mean, they were these gorgeous steaks, wrapped in bacon, incredible. So I called him up, and I'm obviously not going to mention his name, but I said, I have to thank you so much, but that's totally unnecessary. Your daughter's a gem. I know she'll do well here. And there was silence. And I said, is everything okay? And he said, Madam President, my daughter's no longer at the university. And he shared with me that for years she had been dealing with heroin addiction. She'd been in numerous programs, and came to the university and apparently relapsed and withdrew. So I tell that story because some think that college students and people from well-to-do families are immune. People in this room know that's not the case. But somehow our nation has got to deal with this enormous problem. I don't know what the answer is, and I look to experts such as those in the room to help guide the way. So I'll close where I started. If you think about the Carillon bells, and you might think, there's the president boasting about this great facility and these bells, how's that relevant? Well, as you know, these Carillon bells ring at all special occasions, weddings, births, other joyous occasions, and the bell can peal just incredibly beautiful melodies and songs. We're excited that soon we'll be hearing them here, and I'm afraid if you live close to campus, you're going to be hearing them too. So that although today's meeting is just a small part of the ongoing struggle against this huge problem we're facing in our nation, it does hold the promise of a step forward. Just like these bells, they have the potential to carry the sound of hope, and somehow I've got to feel hopeful about the future. So again, welcome to the university. Wouldn't it be great if in 2 years or even 5 years we could get together and ring those Carillon bells and be celebrating the great decline in the number of individuals impacted by addiction. So thank you for your commitment. Thank you for being here today. Again, welcome to the campus, and let's vow to celebrate. We don't know when exactly that'll be, but I want those bells ringing and making a very joyous sound because we have made great progress. So thank you very much.
Thank you, Dr. Dudley Eschbach, for your inspirational words, for the use of this space, which is absolutely amazing, and for always the continued support of Salisbury University for everything that we want to do. We're much appreciative. Now, I am pleased to introduce the guy that I pointed out just a couple of moments ago, Salisbury Mayor Jake Day, who had the insight, and it really was the insight and the commitment to create Salisbury's Substance Treatment and Addiction Reduction Task Force. That's that START task force that we've been talking about this morning. Jake is here to provide an overview of the team's mission and recommendations for the city of Salisbury. So please welcome, from the city of Salisbury, Mayor Jake Day. Good job. Good to see you, man.
Well, good morning. You'll have to forgive me. I've lost my voice a little bit. This happens in the early months of my other job as the senior platoon trainer at the Army Officer Candidate School. I do a little bit of yelling over the weekends, and Mondays and Tuesdays, it takes a little time to recover. So I want to say, one, welcome, and two, thank you for your commitment to our community, and thank you to your commitment to addressing this problem that requires public dialogue and conversation. Silence on this issue is precisely what will lead to the problem getting worse. And so I'm very grateful that all of you are willing to be here today. And here, in particular, in this beautiful space. They said, hey, Mayor, we want to do this in City Hall. And I said, no, we're tired of showing it off. We'll do it here instead. You know, this room's okay, Madam President. You really got a beautiful, beautiful building and beautiful facility here. So I want to talk to you a little bit just about kind of what's going on in this community. And I'm going to ask whoever's in control of, do I have control of the slides? Yeah? Here, let's find out. Yeah, I do. Okay. All right, excellent. So I'm gonna move through the slides, and what I'd like to do is not spend so much time reading to you what's on the slides. You're very capable of that yourselves, but talking to you about some of the things that are in the works in Salisbury, things that we are learning from other places, and things that we are hoping to implement in our community based on the recommendations of this team. About a year ago, shortly after I came into office, we recognized that the city of Salisbury did not have a strategy for responding to or being a participant in solutions to the opioid crisis. We simply didn't have a plan. So by creating this task force, it was an acknowledgement that me sitting at my desk writing out a plan was probably less than an effective path to coming up with the right strategy. It also acknowledged that in a vacuum, any entity was not going to be successful. However, if we wanted to know what role the government of our municipality was going to play or should play, we had to ask. We had to sit down and ask. We don't want to do this alone. We don't want to do this by ourselves, and we don't want to do it independent of everybody else. We just want to know what our role should be. So under the leadership of Beth Olson, who is the executive director of the Recovery Resource Center, an incredible organization in Salisbury, Beth brought together this team, and they have worked for about 9 months developing recommendations that we are now working to implement and working to advocate for with the county, the state, and our private partners. I also want to address that Council Vice President Miraboda, who I think has been acknowledged a couple of times, has made a personal commitment to be involved in this conversation for his neighborhood, his district, his city, his community, and ultimately the entire Eastern Shore of Maryland. Really, the state of Maryland. You're working on state-level task forces now, Muir. So in addition to the START task force, again, you're fully capable of reading some of these recommendations. The city of Salisbury agreed to partner with the Wicomico County leadership, Wicomico County Sheriff's Office, and Wicomico County Health Department and State's Attorney's Office to develop the COAT team. And if you're not familiar with the COAT team and what the Health Department and Sheriff's Office and State's Attorney in partnership are doing, I hope you will ask questions about that during the expert panel this afternoon. It's an incredible effort that directly puts resources in the places where people are using, where people are struggling, and where they are stuck, frankly. These are the places where people aren't necessarily reaching out and saying, I need help, but the places where people are. So extending our resources and our services to where people are in need is one of the steps that we recognize as a community is critical to success. And I want to applaud Wicomico County for taking that incredible step forward. I also want to acknowledge the importance of engaging and educating our youth, and our state's attorney's office has done an incredible job, both now and previously under the direction of Matt Massarello, now Judge Massarello, started the arts competition, the Opioid crisis arts competition, which included both visual arts as well as video competition, and this engaged young people in a conversation. We recognized also that engaging young people is never the expert position of adults, and so they've got to talk to each other. And I want to acknowledge and applaud the hard work of our state's attorney's office. Additionally, we brought in a speaker. The city of Salisbury brought in Tony Hoffman, a nationally known pro-BMX biker who himself suffered from addiction, found himself in the absolute despair of addiction to the point where he broke into people's homes and robbed them at gunpoint. And it is a remarkable story how he recovered from that, is now a leader in the fight against addiction, and is a leader in talking about it with young people around this country. He spoke to every single high school student in Wicomico County, and it was a powerful, powerful message. You could see tears in the eyes of people in the audience, even young people who have been touched by this particular epidemic. We continue to talk about new ideas, like safe spaces in the opioid crisis. Safe stations are working in Anne Arundel County and in the city of Annapolis. It's something that we are discussing in the city of Salisbury. We'll be bringing a plan to the city council in the coming months to begin that designation and the additional work and services that come alongside it. We recognize that our homeless population is suffering from substance abuse and from limited access to mental health care. Our homeless population in Salisbury comes from around the region. We have more than 100 chronically homeless individuals on the lower shore, most of whom have established residency in the woods or dark corners, the railroad tracks in our city. And thanks to funding provided from the Salisbury City Council, we have established a Housing First initiative, which permanently houses chronically homeless individuals, those who have been homeless for more than a year. And we have successfully housed 20% of the chronically homeless population in 1 year in the lower 3 counties. Each of them, through a partnership with the Wicomico County Health Department, each of them is receiving wraparound intensive care services from counselors and mental health care providers. And that includes substance abuse. We track the substance abuse the substance abuse percentage of that population and of the population that's being treated. I want to acknowledge Tasha Jameson. Your work, you're incredible. You are dedicated and devoted to every single person who comes through your office, and you are changing lives. We are so appreciative of you. I also want to acknowledge and thank Lori Brewster, the Director of the Health Department for Wicomico County, and Theo Williams, our Housing and Homelessness Manager, who's here in the room today. Theo, where are you? And Lori's here, right? Yeah, there's Theo in the back. Where's Lori? She'll be here in a little bit? Okay, excellent. I want to also acknowledge some other things Wicomico County is doing that we are incredibly proud of. The Vivitrol program at the prison is I know in its nascent stages, but is also very critical. And the district court drug program is a fantastic program, and it has doubled in size, if I understand correctly, Rich, doubled in size in the last year. The City of Salisbury has recently signed on to the Cities Thrive Coalition. The Cities Thrive Coalition is a coalition of cities around the country led by First Lady of New York City, Shirlane McRae, who has worked to increase access to substance abuse treatment and mental health care services in cities across America by advocating for changes in how Washington governs health care. Now, I imagine the Cities Thrive Coalition is not the only voice advocating for changes in health care provision in Washington, D.C. However, every voice matters in this fight. And mental health care parity in the insurance market is critical to addressing the problems that we are facing on our streets, that our police officers and our sheriff's deputies face every single day, as exemplified by the recent officer-involved shooting in Woodcock Park in Salisbury. If you're not familiar with that, take some time to watch the video and watch how Sergeant Engel addressed that situation, found the tactical patience to remove his finger from the trigger once he realized what was going on, move to cover, continue to communicate with the subject, and safely apprehend the individual without hurting him. I've never seen a more emotional group of people than when the officers who were there and involved watched the body camera footage. But there's a person who has dealt with substance abuse, is suffering from a crisis in mental health, in his own mental health. It was a cry for help, and he potentially put not only his own life at risk, but the lives of other people around him at risk. And it is a testament to not only the training of that officer, but also to a reminder to all of us that we need to continue the fight for access to substance abuse treatment and mental health care. So let me close by saying this. In the first 9 months that I was in office, I appreciated very much the emails that I would get from Mr. Bruckner. It gave me a sense of what was happening in our community. In Wycomico County, 169 people overdosed during that time period. 16 of them were fatal. And in the last 9 months, 132 overdoses occurred in Wycomico County, 11 of them fatal. In the last 90 days were 2/3 of those overdoses. Fentanyl being sold mixed in with heroin. Fentanyl being sold as heroin, leading to a spike in overdoses once again. My point is, we're not out of the woods. We are not out of the woods. We are deep in the woods. But I think we see the light. I think as a state we're seeing the light. I think as a community we're seeing the light. And before I walk off this stage, let me say two things. One, the people who devoted their time for 9 months as a part of this task force, one team, they are warriors in this fight. And I want to ask each of those warriors, each of the 26 people, those of you in the room, to stand up if you were a member of the START task force. And I know you're going to be hearing from some of them later today. And then let me also say this. It all hits home. Last night, my wife and I got on the phone with my mother-in-law, and she shared with us that last night she was able to celebrate with my brother-in-law her 1-year anniversary of sobriety and his 3-month anniversary of sobriety on the same day. On the same day. None of us are immune to this crisis. It's going to hit home for every single one of us if it hasn't yet. So thank you for being warriors in this fight. Have a great day.
Thank you, Jake. Always an inspiring message from the mayor. Great to have you with us. All right, so now we've come to the first interactive session of the day, and this is going to be fun. Promise you this will be fun. Please turn your attention to the screen as we invite you to participate in answering some polling questions using your smartphone. Let's try our first polling question, and we'll see how this goes. This should be appearing on your screen now. What segment of our community do you represent? You can choose as many of these as apply. So go ahead, choose your answers now, and we'll watch the results appear on the screen. So there's your results to the first poll question. And as we anticipated and expected, we have a pretty good cross-section of people throughout the House. 36% of you in education, government 30%, treatment 28%, nonprofit 22%. And you can see the numbers are changing as more of you are adding your thoughts and comments. So thank you so much for that. We appreciate it. All right, let's do a few more. So here's our next question. Do you believe that addiction is a disease? Is addiction a disease? Yeah, that's pretty much a no-brainer, right? 93% of you in the room think that it is. 91%, 92%, again, that's going to jump back and forth a little bit, but that's kind of exactly what we expected that reaction to be. So thank you for that. Here's another one popping up on your screen now. Have you ever been directly impacted by addiction, either through your work or in your personal life? Again, as we've been mentioning all morning long, this is an epidemic, and Jake mentioned it too, that touches everyone. So yeah, that number does not surprise us at all. Okay, our next poll question. Do you know someone who has died as a result of their addiction or drug use? Pretty alarming number, right? Not surprising, but absolutely alarming. Absolutely alarming. All right, and our last question for now, and thank you so far for your results. Do you believe that we have adequate services here on the lower eastern shore of Maryland to address the opioid and heroin crisis? All right, again, interesting response. over almost 80% of you believe that we could certainly use a little help in dealing with that. All right, so thank you all very much. Those are our first series of questions. We'll have more, as we mentioned, for you throughout the day today. Our goal is to always, by the way, have measurements on what we do throughout our events so that we always have data on what our attendees think and feel. That's important to us because, as we mentioned, we're going to use this as we gather people back together again, and we'll be able to constructively position our message to you and get the feedback from you that we're certainly hoping for as we approach the next steps in this process. So thank you. Now in the program, it's my great pleasure to welcome up to this podium a couple of ladies who will bring some great insight to you, and I know that you'll absolutely want to hear from them. Lori Brewster is the Wicomico County Health Officer. She will be speaking about the wildly successful Wicomico COAT program. She'll be joined by Abby Marsh. Abby is the director of the Life Crisis Center here in Salisbury. Abby will be talking about the 211 hotline and how that supports programs and projects like these. So, ladies, the podium is yours.
So, in early 2016, we had issues in Wicomico County that we were seeing, and I think I was in daily contact with the then state's attorney, now Judge Massarella. He would call me at all hours of the day and night to the point where I just wanted to put the phone down and say, no more. But I kept answering the phone, and I think that that was probably one of the best decisions that I did for the community, was to listen to what he had to say. So we started our discussions. They actually began in January because we were seeing an influx of overdose cases that were giving us grave concern. We were seeing a significant rise in both fatal and non-fatal overdoses because we were getting data on both, something that was a little unique to our community. So in March and April, we had a significant spike in the overdoses that were occurring. We had 44 overdoses in the month of March and 44 in April. Now again, those were non-fatal overdoses, but considering the fact that in the first 3 months of 2016, we had more overdoses arrive into the emergency department at Peninsula Regional than we had the entire year prior in 2015. There were 100 documented overdoses that year in the emergency department. We were seeing multiple fentanyl-related deaths, something that was new and different in our community, and it was of grave concern. We decided that there was absolutely no way to address this through arrest and prosecution alone, because that wasn't working. And so we were trying to determine what in the world were we going to do to attack this issue. We needed a more comprehensive solution. And we knew that we could not help every individual, just as the film said, but if we could help more individuals than were currently being helped, then we would have a successful program. Next. So the governor's final report, when he had his task force, highlighted a step toward treatment on demand. Very costly endeavor that we knew was not going to come to fruition in time for us to address the critical nature of the opioid epidemic occurring in Wicomico County. So we decided we cannot wait for state funding. And that was a big step because health departments rely on state funding to begin and sustain programming. So we decided we have to act now. So over the course of the next month, we decided to meet with our local elected officials, both county and city, and beg for funding. There's no other word for it, but we did. We laid out what a successful program would look like, And the decision was, we will give you money for a pilot project for 1 year. And we knew that if we could show significant success, that there was the potential for continued funding locally through the county and the city. But we wanted to intervene before individuals that were out on the street became an overdose death or a law enforcement problem, because the cost to the system was increasing greater every day. The state's attorney's office had prosecuted several cases that had a huge impact on law enforcement resources as well as health resources. Individuals arriving in the emergency department some 2 to 3 times a day, EMS having significant resource drains as well. And we wanted to address the batch of bad drugs that were out on the street. So we decided to put together a program, and we had many partners. The Wicomico County government was one of our biggest funders, and I'm today grateful for their assistance. The city of Salisbury provided additional funding as well. Of course, the state's attorney's office. I may not be in contact with Judge Massarella, but I am in contact with the state's attorney's office, probably more than the state's attorney's office would like to have me in contact with them. The Sheriff's Department, the Salisbury City Police Department, of course the Health Department, and Peninsula Regional Medical Center. And then we did bring on 211 through Life Crisis a little later. So our program design, we tried to come up with a name for the program and decided that Community Outreach for Addictions Treatment, otherwise known as COAT, as we were wrapping services around these individuals. So again, it was a 1-year pilot program aimed at reducing overdoses, both fatal and non-fatal. And the goal was to identify individuals in need of treatment and education and outreach. And we felt that having a bridge to treatment, because we know we don't have treatment on demand at this point, that we may have better success with these individuals. So we embarked on something that was a little new and different. We hired peer support specialists. We had heard of other jurisdictions that had them embedded in hospitals, and so we decided to have them embedded in the community, working with the hospital as well as law enforcement. And I must say that our agreement with both organizations was unprecedented in Wicomico County. We began receiving identifiable data from the hospital on individuals that had overdosed. They contracted with us to have COAT team members arrive into the emergency department for each and every overdose to offer our services. Now, granted, many of these individuals do not accept treatment at the time that our COAT team arrives. But guess what? They are perseverant. They go out and they meet with them as many times as the individuals will allow until somebody says no. It may take 2, 3, 4, 5 times to actually engage them in treatment, but that's what our COAT team members do best. We also have a contract with our law enforcement agency, the Sheriff's Department, and we pay for 10 hours of police time in which we go out and we make runs with the law enforcement officers. They are in plain clothes, and when we identify individuals that we know have been a part of the drug scene, our law enforcement agents, they will say, I'm not here to arrest you, I don't want to see anything that you've got, I'm here to help you. And I think that that has been a successful part of the program. And the fact that most of them are CIT trained officers has been an increasing complement to the program. So we began to provide these services in June of 2016. So last year marked our first year, full year of data. And as I said, we get overdose crime data from our law enforcement officers, and we actually have a mechanism by which our drug task force officers call us for overdoses in which the scene has been deemed clear. So, our peer support specialist, they have to have a minimum of 2 years of documented clean time, and they have to maintain that clean time as well. And as I said, we have 10 hours a week of law enforcement time, and that component there has been, I think, one of the most successful components of our program. We've done a lot of outreach to churches. I think our COAT team members went to every single law enforcement roll call, be it first thing in the morning, late at night. They visited the substance abuse treatment providers, homeless shelters. We know that they get a lot of these individuals. Some of the advocacy groups that are in the community, county and city councils. I've been to the county council numerous times discussing this program and its successes. We worked with the hospital, Peninsula Regional Medical Center, and provided education and outreach to the emergency department as well as the discharge planners, and then of course the Life Crisis Center. So we have our data through May of 2017. We have 183 individuals that have been touched by a COAT team member at least one time. 101 have engaged in treatment, which is not the national average. The national average is about 15 to 20% of the individuals that have outreach by peer support specialists. We've also conducted several hundred outreach efforts, and we continue to do those as well. We have contracted for a formal program evaluation so that we can further identify our program outcomes, and we're hopeful that those evaluation efforts will be forthcoming very soon. I think memos in here somewhere, and we had that discussion. Our COAT team program has been designated as a promising practice through the National Association of City and County Health Officials. We got that notification in May, and there was an award ceremony last week in Pittsburgh that we tried to get to, but it just was not meant to be. We had flight issues. And we are going to apply again next year. The reason why we did not get designated as a model practice was we did not have enough data, because we only had 3 months of data at the time. So we are going to apply this coming year as a model practice for the COAT team in Maryland. And I think Abby's on.
Thank you. As you already heard, I'm Abby Marsh. I'm the Director of Life Crisis and have been since July 1st. Some of you, yes, thank you. And thank you to Pam Gregory for inviting me, and Kathleen Momay and the United Way for inviting me to speak at this. When you think of Life Crisis Center, some people think domestic violence. Some people think maybe our Pinwheels campaign and child abuse. Some people think suicide. Some people may realize and think a 24/7 hotline where we answer the Maryland Crisis Hotline, the National Suicide Hotline, a domestic violence helpline, and hopefully add to your knowledge bank all of those things, plus Maryland 211. The mission statement of Life Crisis Center is to improve the quality of life in our community through crisis intervention and violence prevention. We know crisis at the Life Crisis Center, and we know, everyone in this room, and hopefully many people in this community know that the opioid epidemic is a crisis. Life Crisis Center, through being a United Way agency, as I indicated, answers the Maryland 211 line. It's been funded for numerous years, but in 2011 is when Maryland 211 officially became the primary hotline for health and human services in the state. I'm proud to say that the lower shore in particular, but we answer all the 211 calls for the whole shore, all 9 counties. We're leading the way in providing 211 as a resource, as the doorway to all of the world of resources that are out there that you all provide in this opioid epidemic. What's really, I think, very unique and special about the hotline that we have at our fingertips is that each and every person answering that hotline is trained and certified as a crisis counselor. So they're answering the phone not knowing what's on the other end. Every time they pick up the phone, it could be anything from a question about how to have help with paying their electric bill to someone who is contemplating suicide. And the people at Life Crisis Center who answer the phone can handle every single call. We have worked directly, as already indicated, with the Wicomico Health Department and the COAT team, and we actually at Life Crisis Center, since we are staffed 24/7, we actually provide a temporary home on weekends for the COAT team so they can have company, but also so we don't have to turn on the lights at the health department and use up those resources when we have available resources at our fingertips. We also have partnered with Worcester County Health Department and their Warrior Angels so that warm transfers can be made and an angel can go out to someone who is in crisis in Worcester County. What I think is just critical for me to be able to again say is that remember that 211. Remember that easy porthole to reach all of the resources. It's such a simple, already existing resource, thanks to the United Way and thanks to Maryland 211. And it's that porthole to that all of those other resources that we have. And I'm so grateful to be able to be a part of the Life Crisis Center and to be able to contribute to hopefully impacting positively this problem that we have that's only seems to be growing, and only with the coalition and our putting all our heads together, all our resources and our partnerships can we make an impact. And I am proud to be able to be a part of that. Thank you very much.
All right, ladies, thank you. Lori and Abby, so much. We appreciate the information about those great resources. Time now to invite our panelists to come to the stage. And while they're making their way up here to join us, let's do a couple of poll questions. This one is for educators and those who work with youth, so please use your cell phones to answer this question. Do you have students who have been affected by addiction in their family? Pretty significant number, as we expected it would be, right? 97%, 95%. We know a critical impact of addiction is the effect on family and friends, right? No question about it. Let's ask you one other question. I don't think there's much that I can do to help address the issue of addiction. How do you feel about that? And as the numbers come in, It's good to see that most of you do not agree with that. And most of you believe that there is something you can do to help us with the addiction problem here on the Lower Shore. And being here is the start of that, so we thank you for that. All right, we'll now begin our panel discussion, followed by a few minutes to answer questions. So, in this order, please welcome to our stage Clay Stamp, the Executive Director of the Opioid Operational Command Center and the Senior Emergency Management Advisor to the Governor. Dr. Barbara Bazron, the Executive Director of the Maryland Behavioral Health Administration. Rich Bruckner, the Senior Assistant State's Attorney for Wicomico County. Leslie Brown, the President CEO of Hudson Health Services in Salisbury. And John Winslow, who is the Recovery Leadership Program Coordinator with the National Council on Alcoholism and Drug Dependence for Maryland. Now you can applaud this great panel. Thank you all for being with us. Great to have you here today. And Clay will let you kick the proceedings off for us.
Great. Shall I come up? Or?
You can do it right from there. Your microphone will handle it if you'd like to do it from there. If you'd like to speak from here, wherever you're most comfortable.
Promise not to mess your paperwork up.
You can mess up anything you like, my friend.
Thank you, Roger. So thank you for the invitation to be here today. There are so many people in here that if I just took a few minutes I would love to recognize because you're leaders in your community. Sheriff Lewis, Senator Mathias, Bob Culver, I could just go on and on. It's just, you all are heroes. And it's just good to be able to see you come together here on the Lower Shore, especially for me because I'm from the Lower Shore. So for me, it's like coming home. So I started about 4 months ago, a whirlwind, when Governor Hogan asked me to come to work directly for him to attack the opioid crisis as a crisis, to deal with it like we deal with any other crisis in this country. So this is not a hurricane, this is not a tornado that moves in at 3 o'clock in the morning and destroys houses and what have you, but what this is a crisis. Make no mistake, it is a crisis. And we in this country have a system in place to manage crises. And the governor asked me to use that National Incident Management System to wrap around the crisis in the state of Maryland. He declared a state of emergency because he went from every piece of this state, all through this state, and he heard the same thing from everybody. You got to do something about the crisis. As of June 20th, 1,048 people have died from opioid overdose in the state of Maryland. Over 1,000 people so far this year. So far this year, we have almost 15,000 emergency department visits across the 49 emergency departments from non-fatal overdoses. The numbers are staggering. It's a crisis. At the same time, there's a social stigma attached to this crisis. Many people want to put a blind eye toward the crisis. Not in this room, which is great and inspiring to see, but we have to recognize we're battling stigma. What the governor is selling and what I'm selling is a balanced approach to attack this crisis from a prevention, an enforcement, and an access to treatment perspective. All three are very important. I'm not telling you what you don't know when I say that our treatment capacity is not present. It wasn't there in 2010 when we were dealing with this, but when the numbers went up to where they are today, clearly they're not. It's not been a social priority. That's the bad news. The good news is the conversation is escalating. We have an opportunity to expand treatment capacity, and we need to do it. We need to talk about enforcement, because although the law enforcement community will say to you very quickly, we can't arrest our way out of this, that might be true. But we also need to recognize that we have bad actors that are flowing poisons into our community every day through illicit drugs. We need to make sure our physicians that have the ability to prescribe opioids are doing so in a professional and proper manner. So enforcement's important. And at the end of the day, in order to turn this ship, if you will, it's going to be education through prevention that we do this with. We've got to educate our school children and protect them, help them with their decision making. Prevention is a huge piece of this. So that balanced approach is critical. What we've done at the state is we formed the Opioid Operational Command Center. It's a fancy name, but what it is, it's 11 different agencies that swells to 15, 16 at times to break down the silos of state government to drive goals and objectives. And those goals and objectives are designed to directly support local jurisdictions. The second piece of that is to establish opioid intervention teams, which are a fancy name for community organizations to coordinate an effort. You have one in Wicomico County, Worcester, and Somerset County that's led by your public health officer and your emergency manager. Those organizations are coming together to be representative of your community, to address this crisis at a local level from those three areas that I talked about. At the end of the day, where we make a difference is at the local level. The governor has actually put money behind his words. He carved out $50 million over the next 5 years, $10 million a year, and with the support of the legislature, through their actions with the HOPE Act and some other laws that have been put in place, we're going to continue to make a difference. We just announced that we pushed money down to local opioid intervention teams to allow them to have resources to kickstart programs. And we're going to continue to work with our local opioid intervention teams to help them be successful. The other thing we're going to do is, in my travels over the last 4 months, and I've been in every part of the state of Maryland over the last 4 months, the beautiful news is there are promising practices happening all over Maryland. The interesting thing is not all of Maryland knows about them. So the low-hanging fruit here is our ability to take what's happening in Western Maryland, share in Eastern Maryland, to take the best practice of the COAT program on the lower shore, or the great program that you had through the art competition. Everywhere I go in Maryland, I talk about this art competition. Matter of fact, I talked to Kathleen about making that a statewide project and getting the governor involved. So this is where, for those of you who don't know it, there was art competition held for high school students depicting the disease of addiction, right? And scholarships were handed out, and with Sheriff Lewis's help and others, the funds that gave these kids scholarships came from drug seizure money. We took from the bad and gave to the good, right? So this is a best practice that we can just share statewide. So what we're doing at the state level is working with all these opioid intervention teams and growing these programs. Last Friday, I stood in Washington County with the sheriff in Hagerstown. And I was given a tour of, actually it was a picnic, honoring all the people that supported his day reporting program. So people that were in a detention center that has a disease of addiction received treatment for that addiction. They were plugged into a day reporting program where organizations in the community came and donated their time to teach these individuals how to re-enter society, taught them how to balance their checkbook, taught them how to their proper hygiene, how to socially interact with others, help get them a job, help find them a place to live, and then follow that on. I sat in a room with over 30 people representing organizations that were there to support 4 individuals that were in the room. It takes a village. These are real people. 1,049 people have died so far this year. An average of 5.6 people a day are dying. We need to be passionate about that. This is a crisis. This is an emergency. I'm preaching to the choir to this room, but what I'm saying to you is please go out there, raise the conversation. We have to continue to fight this fight. It's the crisis of the day. It is a state of emergency. The governor is calling all of you, all of Marylanders, to bring your talents to the table and get together for a coordinated effort. The only way we'll win this is if we coordinate our efforts and target our approach. So I'm glad to be here. Thank you for the time.
Clay, thank you very much. Dr. Bazron, you're next.
Good afternoon, everyone. I'm Barbara Bazron. I'm the Deputy Secretary for Behavioral Health for the state of Maryland. I work hand in hand with Clay Stamp on addressing the opioid crisis, and he is right, it is a crisis. One of the things that we know is that we have to have a concerted, joint effort to address this issue that includes prevention, intervention, treatment, and recovery supports. One of the things that I am very much in favor of and plan to expand throughout the state is the role of people with lived experience in helping us to address the opioid crisis. What we know from the pilot efforts that are currently underway in emergency rooms and also in our communities is that individuals with lived experience who come in contact with individuals who have near-fatal overdoses are able to engage those individuals in treatment in 48% of the cases, as opposed to what the literature shows in terms of our regular treatment regimen, which is about 25%. We have to get people services they need and get them in contact with people who can support them. Many of you may not know this, but I am a former high school and junior high school and elementary school principal. Kids and education is typed into my DNA. So when I watched the movie about recovery high schools, my first thought is, why don't we have those throughout the state of Maryland? Why don't we have those? What we know from the national scene, and I recently had the opportunity of leading this discussion for SAMHSA, is that our current system of services and supports and the current strategies that we're using are not as effective with our youth and transition age youth as they are with our adult populations. I think the recovery school construct really represents an opportunity for us. I think that the timing is right. We know now that within the state of Maryland, schools are a place of service for our fee-for-service system. What that means is that we can bill Medicaid for those services and supports and provide them on-site in schools every day for young people as they need them. The other thing that I'm very interested in with respect to youth is something that we're putting in place as a result of the funding that we have available through the CURES grant from the Substance Abuse and Mental Health Services Administration. We're going to use a portion of that $20 million grant, $10 million a year for 2 years, to implement SAP teams, which are substance abuse prevention teams within our schools. When I was functioning as a principal, I had SAP teams in my school. I feel like we're going back to the future with some of the things that were successful in the past. And there was a team of professionals who came into the school who provided education to not only our young people, but also to their parents, provided them with information around treatment, helped to identify those in need of treatment, and connected them to care. Those programs were extremely successful, and it allowed us to provide supports to young people where they are every day in school. And I think that we really do need to do that. On the state level, we also are really focused on prevention, intervention, treatment, recovery, and follow-up. And as Clay said earlier, I think one of the most important things that all of us can do is to not only get ourselves educated about the negative impact of opioids. It is not something to experiment with, but also to get the word out to everyone else so that people can make good decisions. I had the opportunity of speaking with a mom a few months ago. Her child was in high school, was a high school football player, happened to be injured on the field and went to one of his classmates' homes afterwards, and his classmate's mother saw that he was in pain and gave him an opioid medication for the pain. She had it in her medicine cabinet. He took it. He liked it. He began to use opioids. This mother goes on to tell me that they had a daily routine. Every time she came home from work, she called him. from upstairs in his bedroom. He would come down and they would talk about what had happened for the day, during the day. He was an honor roll student, a good kid. She said he didn't respond. She went upstairs, she opened his door, which was closed, and found him dead on the floor. He had overdosed. She found a bent spoon where he had been cooking the drug, and he was no longer with her. She told me that she had no idea that her child was using drugs, none. She said had she noticed that spoons were missing from her kitchen, it would have alerted her to something was happening. She said had she noticed that there were opioids in her medicine cabinet that had been prescribed by a physician for she and her husband for various ailments that they had, she would have gotten rid of them. I ask all of you to go home, to look in your cabinet if you have OxyContin, if you have other opioids that have been prescribed for you, get rid of them. Take them to the nearest police station so that they can be disposed of. Do not make them available for our young people who gather them up and use them as they have farm parties. And they then get addicted to the drug and hopefully do not have the positive outcomes that we saw from the recovery school film that we just saw. Please do that. We are working to work with our prescribers around our prescription drug monitoring program to identify those that are perhaps giving too much of the drug to individuals when they are in pain. Do you really need 30 to 60 tablets when you go to the doctor for minor pain? Ask the question, have that conversation with your physician. We are mounting a large Talk to Your Doctor campaign as a part of our ongoing education effort. Talk to your doctor. Ask why he or she is giving you the drug. Ask whether you need that much of the drug. I think that with education and the ability for us to make positive decisions, each of us can be a part of addressing the problem of our opioid crisis. I look forward to working with you in my role and providing ongoing support as we solve and address this problem. Thank you.
Thank you, elected officials, colleagues, and friends. Thank you for the opportunity to address you. I think I primarily get to stand here today as the result of working with you and for you. My primary skill is getting people much smarter than myself around the same table to talk and figure things out. There's a guy named Herbert Spencer who said something that is appropriate in this instance to me, and that there's a principle which is a bar against all information, which is proof against all arguments, and which cannot fail to keep a man or woman in everlasting ignorance, and that principle is contempt prior to investigation. That'll never work. We've always done it that way. We know how this is going to turn out. All those kinds of statements, they don't fit into what we're trying to do today. I'm not going to ask any of you to do this with me, probably in this environment, but if you'll just humor me, I'm going to start and share something with you, which is how my day starts each morning on my knees, and that's the prayer that I pray, which is, Dear God, please help me to set aside everything I know or think I know about the law, about addiction, about alcoholism, about our solution. Please grant me an open mind and a new attitude as we come together today to find a new and common solution. Amen. And I hope that's what happens here today, is that we come to this with an open mind. My job is really, I view it, started about 9.5 years ago for the Governor's Office of Crime Control and Prevention, and the folks of Wicomico County allowed me to serve as your Safe Streets prosecutor, which our mission at that time excuse me, was to reduce our violent offenders. And what we learned in our county, a lot of our violent offenders also happened to be the large-scale gang members and drug dealers by virtue of economic support to that gang. What we did was to prioritize those offenders, to bring all the different law enforcement agencies around one table to work together to share information. As a young buck coming out of law school with all the optimism of a greenhorn, I thought that everybody shared information, all law enforcement agencies. We all love each other, part of the same team. And it turned out that there was things called jurisdictional lines that I got to watch quickly evaporate as we sat around that table and these partnerships were formed. I watched that strategy work, and I watched us go from one of the, we actually had the 5th highest per capita murder rate to off that top 20, which was our goal, as the result of folks working together, law enforcement agencies cooperating instead of drawing lines. About 3.5 years ago, I'll give him a plug, Bob Culver had the foresight to go along with an idea through our state's attorney's office to fund the first ever in the state of Maryland an opioid reduction strategist, heroin prosecutor, would be a long official title. And what my job was to kind of morph that strategy, what we learned from the proven practices of Safe Streets to apply to this crisis. How do we bring those same agencies to the table? How can we cooperate when we come up with an idea like COAT? I don't know that everybody in this room knows how innovative and outside the box and open-minded a whole lot of folks have to be for something like that to work. So you're going to take a regimented law enforcement structure, right? And now we're going to hire 4 folks that their largest qualification to be peer counselors is that they've burned their life to the ground. The worse drug addict, the better. Oh, you've been in lots of trouble. Good, you're going to really be helpful, right? We're going to sit around the table. The law enforcement officers are going to go, our second call, after we become Narcan trained, and we're open-minded to that, is going to be to the COAT team to have them dispatched. So responding to the scene of an emergency with sworn law enforcement is going to be a really, really bad recovered addict, because we recognize the principle that only someone that's walked a mile in a man's shoes can be useful. That's pretty incredible. And all I got to do was sit around the table and watch our law enforcement agencies be open-minded enough to try something new to address this problem and work together. My other job is, as the cases come into our office, to help separate those serious offenders, the repeat felons, the repeat distributors of the poison onto our streets. Who qualifies for subsequent offender penalties? And let's get those folks out of commission to stop the poison on its way in. Who's a dealer for profit versus a dealer to just keep going one more day? Just keep going one more day. Versus that guy that's bringing it in time and time again. How are we going to treat each of those folks? Who's going to talk to the mothers that want an answer from the state's attorney? What are you folks doing about my son or daughter that was lost? We wanted there to be one point of collection for data, because applying for money requires, it's all data driven. How many overdoses were there? What were the demographics of the data? What is the average age range in Salisbury? If anybody has those questions, come see me. Our state's attorney, Ms. Disher, an incredibly open-minded, open-door policy. I promise she'll make time to get you into the office and to sit down, and I can answer those questions. That's my job. How do we treat those folks? What are sentencing alternatives? What programs are we supporting? How are we working with the district and circuit court judges? I saw you over there, Judge. It's good to see we have a like-minded friend in the district court who's also implemented several district court programs to help us to do something other than lock up folks. I think Nixon in 1971 declared the war on drugs. You guys get to reflect yourself. I don't know the answer. How are we doing? We want to keep doing the same thing? Do we want to sit around and wait? One of the things that struck me about Lori's presentation was the decisions that something has to be done now, and I think that's why we're all in this room today. And my prayer was for an open mind and willingness to act upon it. I appreciate your time, and thank you for having me.
Good afternoon. Again, I am the president and CEO of Hudson Health Services. And for those of you who don't know, we have an inpatient facility. We do medical management and detoxification, as well as day treatment, and we have supportive housing here in Salisbury and 2 houses in Georgetown. I have about 15 years of experience in addiction. I graduated from the University of Maryland with a degree in accounting, and I got a job as an accountant at an organization called Second Genesis, which was a very large treatment facility throughout the DC area in Montgomery County. When I came to work and started to listen to the tales of the people in the treatment programs, I was like, wow, this place is really crazy. So many different things and challenges going on. So my husband and I eventually moved here, and I saw a job, and it was at Hudson Health, and I took it. And the company at that time was in trouble, in real trouble. I think we had maybe 35 employees, and we had to close an outpatient, and we owed a lot of money. I took the job like the second or third day, and Don Harding, for those of you who know him, he was absolutely pivotal in the establishment of Hudson Health in the very beginning years. Came in, sat down in my office and said, you know, Leslie, what are you doing here? I said, well, I'm doing the accounting. He said, I think you have a story to tell. And within about 5 minutes, I was telling him my story about my father, who was an alcoholic and growing up in an alcoholic home. And that passion just flourished from them. And this passion has kept me at Hudson Health. And every day I work to increase capacity of our beds, to produce evidence-based practices, to have the best practices possible. We're working on adding 10 to 12 beds, which will be happening at the end of October. We're looking forward to that, and we're talking about adding a whole crisis bed facility on the shore. Again, we're now at 70 employees. We have 12 facilities. We're going to be adding additional 2, and all I want to do is keep every person who comes in for treatment to completion. I want to fill those beds as quickly as I can. It's a challenge. I've been on the governor's task force 2 years ago when we were asked to testify. A lot of the issues actually have been addressed since then, so there's something of hope right there. I was looking over it last night trying to prepare for today, and there were a lot of things that have been addressed and wonderful programs added, so that's in 2 years. I was the co-chair of the START Task Force, and a number of the things that came out were the addition of detox beds, which are absolutely needed in this community, and also the crisis beds. So I'm really looking forward to working with partners, which I will need to work with, 211, the COAT team, other counties for expansion of services, and I'm really looking forward to that. And I will end that with, there is hope out there. This is wonderful to see all of you sitting here and hearing these wonderful stories of success, so thank you.
I would like to join the crowd and just applaud and thank each and every one of you for taking the time out of your busy schedules to be here with us today to address this program that touches all of us. And I really see that concept that we can do together what none of us can do alone really applying in what we're here to address today. You've heard from Clay representing funding, from Dr. Bazran representing the administration, from Rich with law enforcement. You've heard from Leslie talking about treatment. And I would like to say here, representing recovery, is that I don't know that there would be any point for us working on convening today if recovery was not invited to the table to be a part of this whole thing. I know I happen to be, in addition to coordinator of the Recovery Leadership Program for the National Council on Alcoholism and Drug Dependence, also serve on the board of directors for our local Resource Recovery Center here in Salisbury. But I also happen to be a person in long-term recovery, which for me means that I haven't found it necessary to take a drink or a drug for over 41 years. So we know that, thank you. We know that recovery is possible, and it's important for me to put that message out there, to put a face on, because we see the face of addiction, we see it on the news, we hear it and see it in our newspapers, and in the loss of our family members, our neighbors, our co-workers, and their loved ones, the ravages, the devastation of addiction. We also need to really step up more in putting a face of success for those that have found a pathway out. And speaking of that, and the word hope has been thrown out here a number of times today, we, those of us that were working on developing the summit for today, there was a consensus of agreement that we really did not want to do to invite this summit, this gathering, this collaborative effort, if it were not for ensuring that coming out of this was a message of hope, that there was a point to the suffering, the death, the despair, the wreckages of families. There, on the other side of that, there is hope. There are people that are successful in their recovery, and we need to voice more of that. You've heard some mention today about addiction being a disease. We know that it's chronic. There are acute aspects of this illness. It's progressive. It's incurable. It's potentially fatal. But it can be arrested. People can successfully recover from this illness. And so I want to just historically mention something that occurred in Maryland that was of significance about 10 years or so ago. This was back before there was a merger between the Mental Hygiene Administration and the Alcohol and Drug Abuse Administration to form the Behavioral Health Administration, over which Dr. Bazran now heads up. The Alcohol and Drug Abuse Administration came to recognize with a national growing recognition that we had been treating alcoholism as an acute illness and had failed to really recognize and implement that is not only there are acute aspects of it, but it is a chronic illness. And so we were having people that would go to detox for 4 days or be in a 14-day, 28-day treatment, get a pat on the back and wished good luck and say, hope you go to some AA meetings when you get out or some NA meetings, and we wish you the best. And then we had these high relapse rates for folks. And so there was an acknowledgement, there was a disconnect between the treatment programs and the recovery communities. We also came to recognize that there was an absence of adequate resources within the recovery communities that were serving to not provide adequate help for folks that were struggling to recover. And some examples of that is we know in terms of gaps for resources, that one of the huge ones here in rural areas like the Eastern Shore is the absence, the lack of adequate transportation for folks to be able to get to their 12-step meetings, to get to their treatment, to get to all the commitments for those that are in drug court, et cetera. There's the housing shortages, there's employment needs, there are educational needs, there's childcare needs. So there's a wealth of resources that were inadequately being met in the state. And so this recovery-oriented systems of care that Maryland embraced about 10 years ago has gone a very long way to help connect the dots between the treatment programs and the recovery communities, as well as to shore up those resources within the recovery community, and to help to connect the recovery community with other resources and with the community at large. And as an example of that, many of the folks here, we have folks from all walks of life and all professions that serve and can help and strengthen and provide supports for those recovery efforts. So they are very much needed. So bridging the gap between treatment and addiction, strengthening recovery environment. And one of the things that has been mentioned, I'm not sure, some of you are familiar with it, others are not so familiar, the peer services that have been mentioned, that that's a whole new workforce that has been created over the last 5 years or so, that Maryland has taken the lead with the Brass Tacks Initiative to form this new workforce and bring certification to peer services. There has been a recognition by Dr. Bazran that there is a huge need that is unmet in terms of developing this workforce, getting more folks that are certified and getting them out to the emergency rooms, getting them behind the walls, helping the folks that are from behind the walls coming back into or coming back out of treatment, getting them back into the community, giving them the supports that they need to solidify their recovery. The film Generation that you just watched, and the producer of that film, Greg Williams, who also was the creator and producer of the film The Anonymous People, just in the last day or so, 2 days ago I guess it was, he got sober when he was 17 years old. 2 days ago, he celebrated 16 years of continuous recovery. And he put a message out on Facebook the other day acknowledging his gratitude for the help that he found when he went to the emergency room after wrecking his car and nearly killing himself. And they got him set up into a very good treatment program, and that began his pathway to recovery. But he was recognizing that he was one of the few people that really have the adequate services and help that they need to be guided from that emergency room into his pathway on recovery. And now he is really bringing huge gifts to the whole world with some of his films. And so when we see here in our community the COAT program that is working there in the emergency rooms and beyond in all aspects of our community, great things are really happening in this community that can be replicated throughout the rest of the Eastern Shore, throughout the state of Maryland, and there's some great things that we can help support and be guiding lights for the rest of the nation and the world. So I am so glad to be here and a part of this summit today. Thank you.
Okay, so this is how this is going to work going forward. We have about 25 minutes or 30 minutes before we have to wrap things up today. What we're going to do is start with some questions that we have prepared for our panel. We'll get through those, and then if there's an opportunity to get to some of the questions we have from those of you out in the audience, we'll do that. If we don't fear, they are not going to be wasted. We're going to hold on to those questions for some of our future meetings, okay? So Clay, we'll start first with you, and the first question is, of the $22 million being released by the governor to address the opioid crisis, $4 million is planned to be distributed to local opioid intervention teams for each county to determine how to best fight the epidemic locally, which may expand on current prevention, enforcement, and treatment efforts. Does this distribution include money for recovery services, for example, recovery community centers, money for recovery services, Salisbury's Recovery Resource Center, or supportive recovery housing?
Thank you, Roger. So let me just say the $22 million that was recently in the press is a combination of monies, the $10 million that the governor set aside, $10 million of the Cures grant that Barbara's shop controls, and the remainder is monies from the Governor's Office Crime Control and Prevention. 80% of that collective money is being sent to the local jurisdictions. The $4 million is correct. That $4 million comes out of the $10 million of the state money, and that goes directly to the opioid intervention teams. And the signatories for that grant are the health officer and the emergency manager. In Worcester County, that's the health officer of Worcester County, the emergency manager from Ocean City and Worcester County. And there's wide latitude for how they use that money in the areas of prevention, enforcement, and treatment, which includes recovery. So they have the ability to direct those monies toward that. Additionally, I think Barbara probably could comment on the Cures grant and some of the monies that are available to expand the capacity for treatment and recovery in her grant as well.
Dr. Bazran?
Thank you. Is this on?
Try it again. See if we got it working.
Okay. All right. Thank you. Yes. We actually will be utilizing some of the funding from the Cures grant to provide additional supports, recovery supports. And this includes the peer supports that we're talking about and other things like care coordination services, which are really, really critical. It's one thing to have services and supports available. It's another thing to be able to really link people to those services and then follow up with those services in terms of recovery supports. The other thing that we're doing is we have set aside about $1.5 million for peer recovery services and supports. I am committed to increasing the number of people with lived experience that are available to individuals with opioid addiction issues within our system, and so we will in fact be doing that. One of the things that I want to highlight that Clay said earlier, and that is that the Behavioral Health Administration provides funding and support to the jurisdictions. The money flows through us to the jurisdictions, and the jurisdictions have actually the flexibility of delegating those funds for the services that they feel are needed within their community. Our philosophy is that people at the local level have a better sense of what the local needs are, and we don't want to dictate that from the state level.
Dr. Bazran, I want to stay with you too for the next question. The Eastern Shore is known for having significant challenges, and those of us who live here know that. Significant challenges due to the vast rural landscape around us. How can the Behavioral Health Administration assist in meeting our rural challenges regarding crisis services, things like crisis hotlines, mobile crisis response teams, crisis centers? Also, how can transportation barriers be addressed for crisis and treatment recovery supports?
Thank you. A couple of things. One of the things that we are really exploring is how do we use telehealth to extend services to rural communities? We know that in instances in which it's hard to reach the population of focus, we need to be able to bring those services using our current technology to individuals. And we're doing that in a number of ways. One, we are providing ongoing consultation services and supports to, for example, primary care physicians who may identify somebody with a substance use problem but may not know what procedures or what process to use to address those needs. So that's something that we need to explore. In addition, in our hospitals, we are also launching, effective the 14th of July, actually, a pilot looking at how we provide inpatient psychiatric services in our hospitals where we don't have enough psychiatrists to deal with the issues. And one of the things I'd like to emphasize is that it's really hard to delink behavioral health I only have a substance use problem, I only have a mental health problem. In many instances, people have both, and we need to provide the services and supports to address both simultaneously. With respect to our crisis line services, we do have a crisis treatment center, and I think it was described earlier, the Lifeline, Life Crisis Center, and people can access that through not only the 211 line, but also through the hotline number, which is 1-800-422-0009. Transportation is certainly an issue, and Medicaid, which is one of the ways we fund our system through fee-for-service, does not pay for transportation. So what we do is we utilize our local dollar allocation, the local dollars from the state treasury that comes to our administration that flows to the local jurisdictions to support that. So the local jurisdictions can allocate those funds to support transportation to get people to the services they need.
Thank you, Dr. Bazran. Rich, we've asked you here today to represent law enforcement. However, that term really cuts a very broad swath, and you know that. We have police here, state's attorneys, parole, probations, courts, jails, prisons, etc. Do you have any ideas how to best link law enforcement with the treatment and recovery efforts going on here on the Lower Shore?
Well, I have some ideas that I've watched work, and so I like reporting results. One of the things that I'm a big fan of is getting law enforcement, and I include prosecutors in that, obviously, get them into the mix, in whatever office or capacity possible. One of the beautiful things our state's attorney has allowed me to do is to serve on the board of the Recovery Resource Center, so I'm in there. I know what that organization's doing. I get to sit with Lori on the overdose fatality review team and all the other community partners to see what services were offered to those folks along their, their road of recovery. Where has law enforcement worked and not worked? One of the things that I have learned from that overdose fatality review team, while it's not incredibly popular, one of the things that you don't hear a lot is the value of arrest in recovery. Arrest is often the catalyst to recovery. It is a feed, so to speak. It is the pipeline to the health department. Parole and probation, having someone, in the net of law enforcement, so to speak, so that we can offer them the wonderful things that prosecutors and law enforcement partner with, such as the drug court program, an 18-month, intense program that involves the sheriff's department, the city police, prosecutors, judges, all working together with the health department, sometimes with, private treatment facilities, everyone together. What we can't afford is to have law enforcement that don't know what is available, what their options are, and working with their prosecutors to get an outcome that's mutually beneficial to the citizens, to the economy, and of course to the individual. Some of the things that are working through law enforcement that, again, I beg us to suspend that initial judgment of the beat cop as the bad guy in addiction. Because it's that gentleman making that arrest that brings someone to our county detention center, which at current is the only place where there is a physician for medically assisted detox. To date, we haven't had anyone die there. It's one place you're not going to see a fatal overdose. And you only get there one way, unfortunately. Right? And when you come out of there, we're seeing the beginning of the Vivitrol program. Guess how you get there? That officer on the street, So shake their hand maybe, as much as we're quick to condemn, let's be quick to praise. And then that Vivitrol program coming out of the jail and being escorted often through the benefit of parole and probation and the watchful eye of law enforcement and a good judge over to the health department and ensuring that follow through. guess who it is that gets to approve or disapprove of an 8505 or an 8507 commitment? You know, the prosecutor, the well-trained prosecutor in the courtroom who can go, this person needs help, this person doesn't. This is a drug dealer trying to truncate a sentence, circumvent the system, and get back to dealing drugs. Boy, an 8507 would be terrible for them. But also recognizing the folks that, man, this is the best possible thing for them. Obviously, the COAT team we've already highlighted, it wouldn't happen without law enforcement officers. Again, those suspended sentences with the probation and the conditions that, you know, a good judge can put on those are just invaluable. So thank you.
Thanks, Rich. Appreciate that. Leslie, I understand that Hudson Health Services is proactively seeking to develop crisis beds and also to expand your peer services. Would you mind expanding on that a little bit for us?
Absolutely. When I was on the Mayor's Task Force, the START Task Force, there were two things that really stuck out on my mind as urgent needs. And one was more detoxification beds and crisis beds. And crisis beds means a place where we can put people until we can place them in treatment. I would say a 3 to 4 day hold. We have already gone ahead and purchased a building to move our administration and assessments in, and it's close to our campus. We'll be able to add 12 beds for detox. We are working on how we can get people in ASAP. I also have a location close to campus, which is a house that would be perfect for those crisis beds. So we're in the beginning stages. We need to meet with first responders, 211, life crisis, other treatment providers to see how we could work this that would need a medical component as well as case management. So we're really looking forward to that.
How far down the road are we talking on this?
Building is supposed to be done at the end of October, meaning for us to move in there to leave one building empty and add the addition of 10 to 12 beds on campus. So hopefully everything will be ready to go. I know there is a RFP out there for crisis beds. It was put on hold a couple weeks ago, and I had actually started writing a program plan, and I heard it's back out now.
It's back out online.
Okay,
Yes.
wonderful. So we'll be working on that. As far as the peer recovery support services, a couple of years ago, I noticed that our completion rates, that's completing treatment time, had gone down, having a lot more AMAs, a lot more scuffles on campus, and we went ahead and hired 2 peer recovery support specialists on campus. Slowly but surely, the completion rate increased. The whole community was more calm. Having these individuals to talk to and work on issues has helped tremendously. They plan patient activity days and all. We are adding a number of other peer recoveries to our housing, which will introduce people into the recovery community. So we're really excited about that.
Good, thank you very much. John, when you spoke, you thanked us all for making sure that we included recovery in this meeting, and rightfully so. Absolutely rightfully so. So, in your opinion, what is it going to take from the recovery side to really move the needle forward in addressing this problem that we have, this epidemic we have?
Well, one of the significant objectives that we address in the recovery advocacy work that I'm engaged in is addressing the stigma regarding addiction. And I view 2 various aspects in regard to stigma, and that's the internal stigma of one that suffers from addiction or a loved one with an addiction, and the external stigma that's out there, the stigma that society imposes on those with addiction. We know that one of the greatest barriers to people accessing treatment is the internal stigma that they feel, the shame that they feel in having an addiction. And so whenever we have an opportunity, such as a platform like this, where someone such as me can step forward and help to put a face on somebody that has successfully rebuilt their lives and has no shame whatsoever in being able to speak out and say, yes, I had a horrible problem with alcohol and other drugs, and I found a way to successfully address that and rebuild my life. That can help to encourage someone else to step forward and get help for themselves. We think about, in particular, women with addiction and the shame, the guilt, the remorse, the stigma that's out there for them. So there's that internal stigma that people experience. There's also the external stigma that society imposes. And the more we can hold forums like this, and that you folks, as you become better educated as to the nature of addiction, that it is a disease in which the brain gets hijacked. It is not a moral issue, and you can take that back to your communities. That will help overall reduce the stigma that's out there. In addition to that, there are many efforts that are underway in addressing through recovery advocacy, through shared needle exchange, the Good Samaritan Act, the HOPE Act that was just passed, dealing with drug courts, recovery housing, Narcan availability, access to treatment, and so forth. But I want to just briefly skip back. We've had a lot of discussion, talked about peer services. One of the exciting things that's currently happening in the state of Maryland in regard to peer services that are based on one's lived experience with addiction is that we are now in Maryland opening that up to family members that have lived experience in dealing with a loved one with addiction. That at present we are working to develop what we call an endorsement for those peers that are currently certified that will allow them with this endorsement to have specialized credibility in terms of being a family member with lived experience that can work with other family members. We know that not only so many of the family members have loved ones that are actively out there in addiction, there are a number of them that have loved ones that are in recovery, and knowing how tenuous that may be, especially in the early stages of recovery, as well as those countless families that have lost loved ones. And there is a way for them to give back and plug in, and hopefully a piece of that can help them in their grieving process as they serve to help others.
Good. John, thank you very much. Appreciate that as well. So as a panel, I'd love for you to address the Recovery High School, the alternative peer groups, and what we can do to create something like that potentially here on the Lower Shore.
As I said earlier, as a former building principal who spent many years working particularly with young people with serious emotional disturbances and substance use problems, it makes perfect sense to me. And John and I have talked about this in the past, and I think it's something that we really need to plan on moving forward. What we know is that exactly as it was said in the film, young people who are going to sustain recovery need a reference group that supports that, and they get that in a recovery high school. So I think that along with the groups that follow are essentially are essential and important. And so I see great promise in that, and I'm very interested in having further conversations about that. And as I said earlier, I think that we are in a perfect place because we also can look at how we might be able to utilize our current reimbursement system to help fund it as we move forward.
Clay, anything from the governor's side that you'd like to add?
Well, I agree with Barbara. I've been involved in conversations across the state with counties that are very interested in the concept of recovery schools. Specifically in Montgomery County, they're trying to reinstate the Phoenix School. I have also looked into the program nationally, and clearly it's something that I'm interested in recommending that we pursue. I'm going to be talking with the superintendent of schools for Maryland next week, and we're having conversations about it.
Mentioned that in the rural area that we have here on the lower shore, I'm not convinced that there is the capacity for a brick and mortar recovery high school. Not to say that there is not, but I don't know that there is. There is a lot more information gathering that we would need in order to make such a substantial decision to move forward. But that doesn't mean that there are not other alternative ways in which we could address the needs for our youth that are dealing with addictions issues. And I would also step beyond a little bit, just not only the recovery high schools, but also, this summit is being held here at Salisbury University, and the need, as was mentioned in the film, to expand and to further develop collegiate recovery centers and supports for those. Colleges have been identified as a recovery hostile environments for youth, and you all know that the score, generally speaking, the drinking and drugging that tends to go on in campus, and so there is a need for higher education as well to support youth that are vested in furthering their education in a safe, protected environment.
One of the considerations, if there isn't a brick and mortar school, is back to the school within a school construct. There are lots of models around in terms of if you can't have the full school, then you can do specialty programs in a school within the school environment, which provides that same kind of environmental support and focus for young people who are in need of this service.
What is our biggest need when it comes to treatment and recovery? Rich.
Depends who you ask.
Yes, I was going to say yes, more.
That's a good answer.
I think that, one of the things we do not have, and I think Lori alluded to this, we don't have recovery on demand. And that is a huge need within our service delivery system. In most instances, there is a window of opportunity to get people into care. And if that window closes, then our opportunity becomes much more limited. And so I think that that's one of the biggest pieces that we face right now is treatment on demand and actually filling out the total array of services that we have. We, within the CURE grant, for example, we're looking at how we begin to expand things like halfway houses and clean and sober living environments for individuals who are in need of that kind of support after they have completed their treatment regimen. We also need to spend more time and get more resources around co-occurring competent treatment so that individuals don't have to, I know when I started in the field, if you came to me as a mental health clinician and you had a substance use problem, people would often say, well, you got to go get clean first and then come and we'll treat the mental health problem. We need to be able to do these things together in a seamless way, treating the whole person, and I think that's another one of our needs.
Please, the delegate would also like a local response.
Absolutely. Delegate, when you leave, I'm going to put in your hands a written answer to that I authored about 3.5 years ago and was able to hand off to the Lieutenant Governor, who was just starting to head up the task force. It's entitled Reducing Heroin Deaths Through Rapid Response. And it's a plan to get as close as we can to immediate access to treatment, which comes from a bunch of different angles. What I could tell you, the young lady sitting next to you, it's not unusual for us to talk at 10 o'clock on a Friday night, or for Bo and I to talk at 6:30 on our way to work, or for Judge Rue to call me at 7 p.m. And the problem right now is it's 8 o'clock on a Friday night. no self-respecting opioid addict wants help during business hours. They want help when things are getting bad out there on the streets between 10 p.m. and 4 a.m. And our health departments have hours due to funding of 9 to 5. And we had I think the one that sticks most in my mind, Lori, is a Friday evening about 10 o'clock, a pregnant female who was ready for help, had absolutely hit the wall, was at wit's end, up against, we call it the turning point. And it's that I believe, and this is opinion, that opioid addict has about a 7-minute window where they'll say yes to help. And we can get to them within that 7 minutes. And that's one of the things that's difficult to understand to an average person capable of going to work from 9 to 5 is saying, hey, come back Monday at 9 o'clock and we're going to get you in first thing. First thing, you're going to be first Monday morning. We've probably lost the window. So there's something, 24-hour phone lines, that immediate access to where are we going to send them. You can hear from Lori, there's some special complications with pregnancy in our county about where and when a pregnant woman can get help to get that detox, because it's a special type of medical assistance needed to not threaten or deter the pregnancy. It's a lot. I'll hand it to you.
Just to add on top of that, that with the HOPE Act that was mentioned earlier that was passed this year, in that act is included the plan for crisis centers. In this upcoming fiscal year, one crisis center, Leslie's working on a crisis center, and so to have that access not only to the crisis calls, but for that immediate help that Rich so accurately identified, that the time to provide the help is when somebody reaches out for help, and to have the crisis services readily available for folks to capture that moment could make a difference between life and death.
Yeah, and that's exactly what I was talking about with the crisis bed. The plan I have is for a crisis hub for up to 4 days. Again, it would have to have a medical component, case management, but that would be direct result of the COAT team bringing someone over, or 211 line, the connection of that, and then whether they would come into Hudson for treatment with our additional open access beds, or we could find them treatment somewhere else. That would be what I'm talking about. So that has that on-demand item that Rich and Barbara were talking about.
So,
unfortunately, time is getting to the end, but Clay, final thought on this.
I'd like to thank Delegate Carrozza for her tenacity. Those of you in the room that know her, when she's on something, she's after it. So I thank you for your question. So my observation is that we need to do a better job at determining what our capacity is today and better coordinating the capacity we have. In the Cures Act, there is monies to build a bed tracking system that will help us better coordinate the capacity we have as we begin to expand it. So I think that's critical. And the other point to make is we have multiple windows of opportunity with individuals. And so at every one of those potential windows of opportunity, we have to meet them there with the ability to port them into our capacity. And one of the primary ones that we're targeting right now are the 23,000 ED visits last year of non-fatal overdoses, because they have a higher propensity to overdose. So most of the time you talk to anyone that has, an addict, they'll tell you that when their life changed, they hit the bottom. That's the window, right? So for some people, that's when they're in the emergency department. For some people, that's when they're arrested. So at each one of those windows, we have to have the ability. And again, so I think directly to answer your question, I don't think we have yet determined the capacity we have, and we're not coordinating it as good as we can do, and that's what we need to do, number one. And we have the ability to build this system to do that. And then that system will be in place to monitor and distribute people to the appropriate kind of care moving forward as we expand it.
Clay, thank you. Outstanding feedback from our panel today, right? How about a nice round of applause again? We could have easily gone for another 30 minutes with this group. I do want to remind you that the questions we didn't get to will be compiled. They will be used down the road. So thank you very much for your thoughts. We do appreciate those. We have a couple of wrap-up questions for you, though, before we end things today, and we'd like to get your thoughts on these as we close out the meeting. This one is a repeat question. We just want to see if there's any shifted opinions. Do you believe that addiction is a disease? Pretty much right where we were this morning, right? Not a lot has changed. Next question. How important is the need for additional services and programs for youth struggling with substance abuse in our community? Critically important, right? No surprise there. Just a few more for you folks. How useful is the Generation Found film as a tool to share with the general public in order to generate further discussion in addressing this crisis? That's interesting. Thank you for your thoughts on that. How important do you believe it is for us to work collaboratively on the Lower Shore across counties to address the opioid and heroin crisis? Thank you for that. Would you be interested in participating in future coalition events? The vast majority of you would be, and we thank you for that. Please, for all of our speakers and for all of you in the room, another round of applause for everyone being here today. We really appreciate you taking the time out of very busy schedules to do this. And again, as we mentioned, this is just the beginning. We certainly want to involve you in other regional projects as we go forward, and we certainly hope that you will want to do that with us. Thanks to the Governor's Office. Thanks to the great Salisbury University staff for making this day possible. And again, thanks to all of you for being here today, and have a great rest of your day.